Welcome to Secrets of Nursing Homes, giving you a sneak peek of the hidden underbelly of nursing homes. Hi, this is Kathy. I'm going to be talking about nursing assessments. This is for the average person. It's not going to be really in depth, but it will cover the basics. I brought my son Rodney. He's going to be asking some questions or making observations that somebody who's not in the medical field might have. So tell me what you think vital signs are.
So, vital signs are signs to your life.
Okay, and what are the signs that you're alive?
Well, I imagine that is the breathing and your heart rate.
That's the very most important thing to vital signs. Nursing assessments are usually started with vital signs, and that's a good time for the nurse to get a quick overview of the person and see if there's anything that stands out right away that she'll be investigating more when she does the nursing assessment. She'll be checking your pulse to see if it's steady and regular. She'll be checking your respirations to make sure that you're not having any difficulty, and she'll notice if you have a cough or a wheeze at that point too. Taking your temperature to make sure it's in normal parameters, and then doing the blood pressure as well, which can tell a lot of things and give her an indication which way she should go. If I was to do a cardiac assessment on you, what would I be doing?
Checking my heart.
And any more than that, what am I going to be checking?
Like the pulse, probably the rhythm, blood pressure maybe.
Okay. What about respiratory?
Well, your breathing.
Okay. What would be something that might stand out to me as being wrong?
If you're breathing really slowly, or it looks like you're struggling to take a breath.
Okay. The cardiac assessment is very important. The cardiac and respiratory are basically done together. So as far as your heart, we want to make sure that it's strong, that it's beating well, steady. If you have any EKGs, we'll want to attach them to your chart right away. We'll be listening with a stethoscope for heart tones. We may be checking different pulse points. We'll want to know if you have any history or if you have any pain, if you're taking any medication for your heart. Those are all things that we'll be collecting right away. In fact, we'll collect a list of all the meds that you take at this point, whether they are prescribed or over the counter. We need to know them all. We'll be checking your lung sounds with a stethoscope too in several places. We'll be listening for the pitch and if there's any changes from one side to the other. We'll be taking your O2 sat to see what your oxygen saturation is. If it's under 90%, we'll be making some arrangements to get you on oxygen, most likely. And we'll be asking if you have any pain and if you're on any inhalers or nebulizers. We'll make sure that if there's anything that you keep by your bedside, like an inhaler or with a cardiac nitroglycerin, that we can get those ordered in by your bedside, or what we call a PRN medicine, that we can give it to you when you need it. And we're going to talk about neurological. What do you think when somebody says, what if I said I was going to do a neurological check on you?
I'd be like, are you thinking I'm crazy?
Don't ask me that. So what would I do to quickly check your neurological status in 20 seconds or less?
I don't know how you do it that quickly.
Yeah, you can do it just like that.
That's amazing.
Okay. The neurological check is very important. It's done very quickly. We'll check for your sensitivity to light with your pupils. We'll be checking your reflexes. It only takes about 20 seconds to do a quick review. If we notice that there's any impairments, we might do a mini mental exam. We're checking for things like memory loss, dizziness, headaches, agitation, depression, and mood swings. And those things will all come out on the neurological check. Gastrointestinal.
I imagine that's what comes out the other end.
There's a little more than that. It's got to go in one end too. I'll be talking about the gastrointestinal, the urinary, and the reproductive at the same time here. They're generally all in basically the same place. Your gastrointestinal would be your stomach, intestines, and anything that food will travel through. Organs that surround them, like your gallbladder and things like that. You might be checking for pain, might press on your abdomen. We'll be using a stethoscope again to check four quads of your abdomen for bowel sounds. Just check them if they sound tympanic, which means high pitched, or if there's anything that's irregular about that. We'll be asking about your diet, what your preferences are, or if you have any allergies. We'll be asking you about your stools. Do you have any constipation or diarrhea? The urinary system will also be asking you questions if you have any pain, if you have any problems with urination, if there's any blood in your urine. We may ask for a urine sample at this time. And then finally, the reproductive system, your body will be checked. It will be with much discretion and privacy and respect. We want to know if you're having any problems with pain or discharge or anything like that, and just be honest and let us know. If you had pain and I wanted to know exactly what it was and how it was affecting you, what would you need to tell me?
Probably where it was, how bad it was, how it was painful.
Okay. It's very important to know if you're in pain. Of course, you want to know where it is. Do you have a headache? Do your feet hurt? What is it that's causing your pain? And we'll be asking you to tell us on a 1 to 10 scale, 1 being the least amount of pain and 10 being the worst you can imagine. We'll want to know if that pain is sharp or if it's dull. Also, if it's a burning pain or a throbbing pain. And then also we want to know if it's intermittent or if it's a steady, always constant pain. We want to know what brings on the pain, and we also want to know what you do to relieve the pain, whether it's a heating pack, if it's taking meds, do you have a prescription, do you use a TENS unit? These are kinds of things that we need to know so we can figure out what we need to do about your pain and get that under control. One thing you should know is if you do have pain and you're in a facility or if you're at home, don't wait and let it get completely out of control before you medicate it. Medicate early so you can keep control of that medicine so it doesn't get wildly out of control. I did want to touch on blood pressure because it's kind of a confusing thing for many people. We generally look in categories. Is it normal, pre-hypertensive, hypertensive, or are you in a crisis mode? So I'm just going to read off some parameters. The lower number is the diastolic and the higher number is the systolic. That's what we call it. So here's a normal blood pressure would be 120 over 80. A prehypertension would be 120 to 129 over 80 to 89. Stage 1 hypertension would be 140 to 159 over 90 to 99. Stage 2 hypertension would be 160 plus over 100 plus. And then finally, you're in crisis if your blood pressure is 180 plus over 100 plus. We need to know that right away so we can call the doctor and we can get you into treatment, especially if you're in crisis mode. We also want to talk about how you walk. It's called ambulation. Want to know how your gait is, if you're steady, if you're unbalanced, if you have any problems, any pain. If you have history of falls, it's very important to tell us. We want to keep you safe during your stay in our facility. So let us know. We'll work to get you stronger. Finally, we're going to be doing a skin check. A skin check will be checking all the skin on your body. And sometimes that's done in bits and pieces as we're going through. It's very important. We're going to be measuring any wounds that you have or any scars from previous surgeries. We'll be measuring those as well. We'll be noticing any moles, any appliance that you have inserted. We'll be looking for the skin around that to make sure that that is clear and clean. It's good to have a complete skin check so we know where we're starting from, especially if you're a diabetic. It's very, very important to check your feet and your toes as well, and we'll be keeping a track of that throughout your admission. I think it was very interesting to talk to my son because a lot of times I look at things through a nurse's eyes and you forget that patients don't think the same way as nurses do. They don't think things through, and why should they? If your body is working and it's fine, your mind is on other things. If you have something to say and your nurse didn't ask you, make sure that you speak up, you ask the questions, and you tell them the things that you need to know. Because this is the time, the very first and the most major time that you have to speak about what your illnesses are, what your aches and what your pains are, what your worries are, what your hopes are. So please speak up and don't wait for somebody to ask you a question. You ask it yourself. I hope this helps you when you go into any facility, that you will feel a little more comfortable knowing what's going to happen, so that you feel more comfortable when you do go into any type of nursing facility. Thanks for being patient and watching. I appreciate that very much. Stay tuned because there will be more videos coming up. Thank you for watching. If you like us, please subscribe and pass it on. Consider becoming a Patreon to help us pass this information on to people who really need this. Thank you so much.